Candida is a normal resident in the gut. So it's not to say any Candida is a bad thing. As we're learning more about the microbiota, the world of bacteria, fungus, protozoa, viruses, the concept of balance or eubiosis is becoming progressively understood to be the target. 2023 randomized control trial, 80 women, in this case with vaginal Candida, certainly something that's unpleasant, odor, discharge, discomfort. They were given either fluconazole, which is a antifungal medication, or a probiotic. And in this case, the probiotic was a capsule, Lactobacillus acidophilus at 1 billion CFU per day. So standard probiotic, standard dose. Comparatively, they found that the probiotic was as effective as the antifungal medication fluconazole for resolving vaginal Candida. The fact that one of the mechanisms through which probiotics fight Candida is, said simply, they will poke holes in the membrane of Candida, and therefore the things that Candida needs to undergo cellular metabolism can leak out, and other things that your immune system might be using to kill the Candida, like inflammatory cytokines, can permeate in. And for those of you watching this, that is what you're seeing in this schematic from a journal paper, just to try to give you one more reminder that probiotics are actually quite effective antimicrobials, whether the microbe be Candida, bacteria, fungus. And we'll cover a study in a moment that hits this concept, which is really important. They're not indiscriminate, meaning if you took a dose that maybe was higher than you thought it should be, you don't run the risk of missing the sweet spot and wiping out all of the Candida from your gut, because we're using these live organisms that confer health benefit to the host. What we don't see is something like you might see with fluconazole, which is some sort of rebound, overgrowth, or imbalance, because the fluconazole is much more foreign, and a probiotic, given that we are replicating exposure to environmental bacteria, which we have quantified from a very early time point in life, was an important part of our evolution, just like pressure is to bone and resistance is to muscle. So therefore, it's much more difficult, I suppose you would say, to use probiotics incorrectly. As it pertains to gastrointestinal Candida, there's a pretty impressive body of data looking at kids or neonates who have Candida or for whom Candida is trying to be prevented. And I'll just share with you a meta-analysis finding probiotics are effective in neonates for either, again, preventing or treating Candida, and also in adults and children for what's known as oral candidiasis. This is where you might have a white tongue, bad breath. Another systematic review, again, these studies are going to be summarizing multiple clinical trials, all demonstrating efficacy with probiotics for Candida. So just a simple therapeutic probiotics that can be effective to help get Candida to the appropriate level of balance. Because remember, it's not this goal of strict eradication, but rather trying to get back to what's known as eubiosis, or a balance in the colony. By the way, if this has been helpful, please comment and subscribe. Okay, so what about leaky gut? There's another really impressive growing body of evidence pertaining to probiotics for leaky gut. And most recently, a 2023 clinical trial, 27 patients with the symptoms of IBS and leaky gut. They were given a blend of Lactobacillus and Bifidobacterium species at a dose of 20 billion per day. Again, pretty standard dosing, and we'll give you some sort of summarizing data on a probiotic protocol you can use later, but nothing here aggressive about the dosing. They found that probiotics improved leaky gut in 82% of the individuals in this study. Pretty remarkable. Here is a really important point. They found no changes in what's known as serum or blood zonulin, so a blood test for leaky gut that measures a marker of leaky gut known as zonulin. And we've discussed in the past that this is a good, accurate, and validated marker. However, that being said, you're not always going to see a given lab marker track with symptomatic improvements. Here's the twist in this study. They found improvements in IBS symptoms of abdominal pain and diarrhea. They found improvements in leaky gut in 82%, like I just said. But wait a minute. They didn't see an improvement in the blood marker of leaky gut. So what gives? Well, they tested leaky gut via 2 measures. One was a serum zonulin. That blood test didn't change, even though people had improved symptoms. They ran another test, one that's a little bit more, if you will, exotic. Radionucleotide tracers. So now they can actually watch as someone eats these tracers or food that's laced with tracers and watch it make its way through the gut and see, does it go leak through inappropriately or does it kind of pass through the feces? And this is where they documented the 82% improvement in leaky gut. So to sort of summarize this, people saw improvements in their symptoms, the abdominal pain and the diarrhea. Most important, they saw improvements in the radionucleotide tracers in 82%. But the serum, the blood test zonulin, didn't improve. So why this matters, if you're using the testing to tell you if you've done the right thing and maybe ignoring your symptoms, that can really shortchange you. So again, I think the evidence supports in this realm of functional GI care, using your symptoms as the most accurate barometer to know if a therapy, given in this case probiotics, is improving your health, improving your gut. Now, coming back to what I mentioned a moment ago regarding multiple ways in which probiotics can move us to this eubiosis and therefore help reduce leaky gut. This is a diagram we adapted from the journal Frontiers in Immunology. This was the really exciting paper from 2023 that found probiotics can effectively fix leaky gut. And what they're showing you here is that probiotics will restore this microbial homeostasis or balance in the bacteria, in the fungus. And as a byproduct of that, will reduce inflammation and simultaneously will reduce, in this case, serum zonulin. And I just wanted to share that to help make the point of all the benefits exerted by probiotics. And to kind of close the loop, this study did find that serum zonulin is accurate. So I want to acknowledge that. But 2 things can be true at once. Serum zonulin can be an accurate marker, 1. And 2, some people will see improvements in their symptoms and may not see improvements in serum zonulin, which is again why I think it's most important for us to use symptoms as the gauge